Kinesiology tape was created by Dr. Kenzo Case in 1979 and originates in Japan. Dr. Case's goal was to create an alternative to the current athletic tape options. This alternative would provide support without limiting movement and could be worn for longer periods of time. Prior to the 2008 Olympics, the tape was mostly used in Japan. Today, kinesiology tape is used by many people worldwide. Kinesiology tape is a thin, elastic cotton band and is latex-free to limit allergens. It is made of a porous fabric to limit irritation and uses an acrylic adhesive to stick to skin. The elastic nature of the tape is very similar to human skin, which prevents restriction of movement. Kinesiology tape is available for anyone to use, however, the majority of its use is done by athletes. The versatility of the tape allows it to be used in the treatment of a variety of musculoskeletal and inflammatory conditions. Kinesiology tape is commonly used on ankles, shoulders, knees, wrists, and many other body parts. Kinesiology tape aids the healing of tissue by boosting circulation and metabolic activity. When the skin is stretched while applying the tape, convolutions are created, which increases the interstitial space between the skin and connective tissues. This allows better circulation of lymphatic fluid. By stretching the skin, the space is decompressed and the pain receptors are no longer being stimulated, which helps with pain management. Kinesiology tape has a variety of claimed benefits. One of these benefits is pain relief. It is also claimed that the tape may help improve proprioception, resulting in better stability. This improved stability plays a large role in injury prevention. The proprioception improvement also leads to the claimed benefit of performance enhancement.
Kinesiology tape, or KT, has been studied several times for its potential effectiveness in managing pain and preventing injuries. In a randomized control study done at the University Laboratory of Federal University of Rio Grande do Norte, researchers tested the popular claim of KT's effectiveness for reduction in pain, as well as other reported claims of it being able to increase blood and lymph circulation and reduce muscle tension. The prospective randomized control trial with intention to treat analysis is a very reliable approach that this study takes for assessing the effects of interventions. The study was authorized by the Research Ethics Committee and registered on the clinicaltrials.gov website. Adherence to ethical principles and transparency were ensured throughout the trials of the study. To test this claim, the researcher took a population of 108 females with chronic, non-specific lower back pain, age 18 to 50, and randomly divided them into groups of 4. Incorporating a large sample size is important to achieve the most accurate results. However, limited generalizability shows itself as a great weakness in the information of this study. This limits the findings' applicability to other demographic groups with different forms of low back pain. Participants were assigned to one of 4 groups: control group, or CG, kinesiotape with tension group, or KTT, kinesiotape without tension group, or KTNT, and micropore group, or MP. To ensure limited biases, the participant order was determined by number concealment in opaque envelopes and having separate researchers for the assessments. The tape was applied in the form of an eye over the erector spinae muscles bilaterally in the KTT and the KTNT groups. To measure the pain outcome, assessments were taken at baseline 3 and 10 days after the intervention. These assessments were evaluated on a numerical pain rating scale, with 0 being no pain and 10 being worst possible pain. For the controlled group, the rating went from 4.9 on baseline to 4.6, which shows no significant change. However, for the KTT and the KTNT groups, a decrease in pain was noticed as the rating went from 4.9 to 3.4 and 4.9 to 3.2 respectively. The findings from the study suggests that, quote, KT is capable of reducing pain when applied with or without tension, end quote. Macedo et al. 2019. A wide range of outcome measures were used to provide a thorough assessment of the intervention's impact. The consideration of strength, electromyographic amplitude, trunk range of motion, pain perception, and impairment helps provide a clear understanding of the evaluation. Both the KTT and the KTNT groups showed better pain alleviation than the control group, proving the tape's effectiveness in lowering pain related to chronic non-specific low back pain. They also suggested disability reduction and functional advantages, which is a big claim to make and prove, but they found results where they can say that their claims are true. Based on the results observed, it can be used as a good argument for KT to convince a potential user of its reliability. Although attempts to limit bias were made, the study overlooked a significant detail when putting the trial into action. Individuals with certain characteristics such as BMI over 30 kg per square meter or previous use of KT were excluded, subjecting the study to selection bias and affecting the representativeness of the sample. On the topic of bias, while the assessor blindfolded design reduces possible biases, results could still contain bias if participants and intervention providers are not blinded. This can also create the possibility of a placebo effect, making it difficult to fully confirm if the benefits were unique to KT. Although the mechanisms used by the KT are not clear, it is suggested that the reduction in pain is sensed due to the application of the tape on skin, which activates the cutaneous mechanoreceptors. However, it is considered beyond the scope of this study. Although this study supports the effectiveness of the tape in reducing pain, shows improvements in pain and impairment in the short term, the length of the follow-up may not account for the intervention's sustainability or long-term efficiency. There are also studies that show no effects or changes. A meta-analysis study conducted by Sean Williams tested the claims as well and found that there are no clinically important results to support the claim.
Another claim made towards kinesiotape is its usage as a preventative measure against sports-related injuries. A pilot study conducted to see effects of the kinesiology tape showed indirect results that support the use of the tape. It involved 12 young women with healthy knees, testing their knee proprioception with and without tape. Results indicated enhanced proprioception after uphill walking in these women. However, the small and homogeneous sample size severely restricted the capacity to draw any conclusions. The health status of the participants is a crucial element that can significantly impact confounding variables linked to the underlying knee disease. While focusing on healthy women is both a strength and a weakness, it restricted applicability to individuals with knee diseases or different demographics. Another meta-analysis delved into the efficacy of kinesiotape, encompassing 10 diverse articles meticulously selected for their adherence to strict inclusion criteria. Led by Sean Williams, the study focuses on musculoskeletal outcomes and included only those trials with control groups. Williams pointed out gaps in research, notably the scarcity of studies on sports-related injuries and insufficient attention to injured athletes, with a critical focus on the number of outcomes including pain, range of motion, proprioception, strength, and muscle activity. Williams critically assessed the effectiveness of KT and offered insights into both its possible benefits and limitations. The study concluded that there was a little quality evidence to support the use of KT over other types of elastic taping in the management or prevention of sports injuries, and that further studies are needed to be done to confirm these findings. While thorough, the study lacks direct evidence in sports injury context, with only 2 studies examining such injuries and 1 including injured athletes. A more unbiased approach is needed in future studies, as highlighted by numerous case studies favoring KT, indicating potential biases and emphasizing the necessity of having a more scientific inquiry to establish its efficacy definitely. Lastly, in another study, the researchers tested the effects of taping on proprioception at the ankle. In this study, 30 healthy subjects, 15 being females and 15 being males, were recruited and assessed over a period of a week. The assessment used a reproduction of joint position sense, where the subjects were asked to recreate a randomly selected position with their ankle. Their outcome measurements were taken in condition of no ankle tape and ankle tape. The results showed that the application of the tape did not impact the reproduction of joint position sense. Overall, the study concluded that further research is required to fully understand the effects of taping to improve and provide insight into the potential benefits on injury prevention.
In conclusion, KT tape has been increasingly more popular, with there being studies suggesting that kinesiology tape can be useful when treating low back pain and might even improve proprioception in certain cases. However, the overall picture of KT tape remains unclear, with there being many studies that have found either KT tape to be effective and some finding no effects or changes at all. Like the randomized control trial that was conducted in the laboratory of the Federal University of Rio Grande do Norte, there continues to be concerns regarding the kinesiology tape capabilities in preventing injuries. The meta-analysis done by Sean Williams calls into question the concept of the broad effectiveness of kinesiology tape and stresses the importance for further research. Similarly, the studies that looked at the impacts of KT tape on proprioceptions on both knee and ankle have exposed how complex the effects are, highlighting the need to conduct additional research. As a result, kinesiology tape can appear to be effective in some cases, but more in-depth research is needed to cover current gaps.